Hello, Hattie Wells. You're an ethnobotanist and cannabis activist, and you've been active in this space for a number of years. And if I remember, if we had been talking about this some years ago, that the idea that cannabis would be legalized, it seemed utopian. And now the discussion is more about what models should we use. And perhaps Britain can learn from the experience of other countries when developing its own model. Now, Hattie, you've been looking at different regulatory frameworks around the world. Can you perhaps start off by giving us an overview in which countries and states cannabis is now legally available for recreational users?
Yeah, so I've been looking at cannabis policy reform mainly in Canada and the United States. But obviously, we have recreational cannabis use legalized in Canada and Uruguay and various states in the US.
Mm-hmm.
And various countries have decriminalized cannabis use, and other countries have regulated medical use.
So medical use is much more widely available, also in various European countries, and to an extent also in the UK, I suppose.
Yes, theoretically in the UK, yeah.
Yes, it's a lot has changed, but a lot hasn't changed either. It's not widely available, not easily accessed. But in other European countries, it is widely available, it seems.
Yes, well, easier to access, certainly.
Yeah, and what about in the US?
So I've been doing some research for an NGO, Spanish NGO, ICEERS, looking at what has worked and what hasn't worked with cannabis policy reform, with an eye and a kind of view to figuring out how to do this better for psychedelic policy reform. So what I've kind of come across mostly in Canada and to a certain extent in the US is just a constant kind of reinforcing of barriers to access. So that's access to the plant and access to the cannabis industry. So I've been talking to activists, growers, people involved in policy change. And while, obviously it's a massive step forward, and like you said, this would have been utopian kind of 10 years ago to think that this was happening. People are complaining about high cost, lack of accessibility and poorer quality of cannabis, which means that the criminal supply chain is still thriving. And even though people will say in Canada, I think people will widely quote that 50% of the market is now legal supply, I think there's some dispute around that, because what I've heard is it's actually 50% of people are purchasing legal cannabis, and the number of people purchasing is not the same as the market. And because 20% of users actually use the most cannabis, and those heavy cannabis users are still buying off the black market.
Well, it's difficult to assess the market. It could be the number of users, it could be the physical quantity of cannabis bought and sold, or it could be the value of in monetary terms. And I imagine that the legal market is often, the cannabis in the legal market is traded at a higher price than in the illegal market. Would that be correct?
Yeah, that's the problem. The cost has gone up dramatically. So for medical users, and also in Canada, the medical use pretty much got eradicated. They still have access via internet sales, but there's no more medical dispensaries, and medical users aren't tax exempt. So the price of their medicines has gone up astronomically. So if you have a situation where, the legal market is supplying a medicine at this cost and your dealer down the road is supplying it at what you used to pay, well, of course you'll go there. So
what about quality control? I mean, does the dealer down the road provide quality control?
Well, I know. I mean, this is really debatable, because I actually haven't read any studies about sort of samples of cannabis off the black market in Canada, whereas we have it in Europe, we have it in England. They've just published a study of black market cannabis in Madrid that says 35% of the samples have got fungus that are detrimental to human health, and that's a large amount. And I don't know what the figures are for the Canadian black market cannabis, but the craft growers, have been growing for decades, and people have come to trust that supply.
I see.
And so I think they're still using it. So there's this problem of kind of access to legal, and also you've got geographical problems. You know, there's different numbers of dispensaries in different provinces or different states that make it easier in certain places to procure cannabis and harder in others, which will also mean that people won't be buying from legal stores.
Just explain to me why the medical dispensaries have disappeared.
Well, that's what happened in Canada. They just made it all recreational. They eliminated the distinction, essentially.
I see. Is that a problem for medical cannabis users? Can't they just go to one of the retail outlets and obtain their cannabis from there?
Well, the problem is the price. I mean, obviously, and it took a while for the edible market to open up in Canada, and that is now open, and there are edibles. But the edibles, for example, if you're a medical cannabis user and you have a need for high THC levels each day, then your edibles have gone up to the tenfold in price. And
okay, so this is something. Sorry.
Well, and obviously you've been used to certain strains for certain conditions, and they may not be available in the stores. I think that's, some people will say, oh, I think, in Vancouver, if you go into a store, you've got a wide choice. You've probably got 30, 40, 50 strains like you used to in the dispensaries, but other provinces, it's not the same. You'll have a limited number. You can't see or touch or smell the product. It's kind of a paltry sort of glass jar in the middle with a few buds in, and otherwise, the bud tender goes out the back, gives you your thing in a sealed package, and you can't see what you're getting. So there's a lot of complaints about quality.
Tell me the price. Why has the price gone? Where does that come from suddenly?
Well, that's because of the cost of getting licenses. So you're paying, you have to have licensed facilities, which are incredibly expensive to establish because of all the regulatory standards required. And then you have to apply for a permit, and that can be astronomically expensive. And then your product is taxed. So that adds, all of that adds to the cost of the...
So there are 3 separate tax takes. First the license, then the permit, and then a sales tax.
Yeah, and sales tax, yeah.
And are they all collected by different administrative bodies or different state, municipality, or federal governments? Is it all different government agencies that are profiting from it?
That I can't tell you exactly. I don't know who's profiting for what, to be honest. I mean, I know that in the States, obviously there have been an awful lot of allegations of corruptions of public officials being bribed to give permits quicker and at lower prices, and the FBI have got involved, and there's allegations of cronyism in Canada. The connections with certain politicians have favored certain situations with license applications.
That's interesting. I mean, it seems to be that the idea of legalizing, regularizing something that has been pushed underground for so long is not a smooth transition. It's not an easy process.
No, and to be fair to Canada, they've made a great step forward, and I think they're in the process of sort of, gaining equilibrium between all the various stakeholders involved and finding some sort of balance. And it will take time to level out.
But coming back to government revenues, I think this is one of the ways that legalizing cannabis is often sold to a skeptical or a wavering audience, people who are not activists like yourself, who are perhaps undecided on it. And the tax take I've heard in states like Colorado is really significant. It's really adding something to public coffers. Isn't that something that is attractive? Raising funds for education, for treatment centers, for children, for good causes.
Yeah, I mean, obviously it's very attractive. I know that in the UK, a Beckley report stated that would make $1 billion, per year in taxes off legalizing cannabis. But you have to balance that with the cost for the consumer, because if you don't get the price right, the consumer's going to remain within the criminal supply chain. but it just isn't going to work effectively.
Yes, criminal supply chain has a certain ring to it. I mean, often it is criminalized. The people themselves are criminals only in the sense that they're supplying an illicit product. But you also have organized crime groups who are producing, often adding ingredients, or the conditions are unsavory, so that there's fungus, as you mentioned earlier, in 35% of the samples. And of course, labor conditions may be exposed to it. So the criminal element is something that we want to eliminate. Isn't that one of the main advantages to be gotten from cannabis legalization?
Yeah, of course. You want to remove criminal penalties and stigma. And you can do this in various ways. You can do this through decriminalization of possession and and growing, or you can do it through legally regulating the supply. Yeah, I mean, I think at least most people involved in drug policy reform are in agreement around the need to stop criminalizing people, and the fact that it's been racially driven as well, and certain populations are more discriminated against and more heavily penalized.
Sure. I think the evils of prohibition are pretty well established. What is so challenging to us is finding the right framework for moving beyond decriminalization, because that is a good positive step, but it's not enough. We also need to regularize the supply itself. What in the Netherlands is often called the back door, the back door to the coffee shop, needs to be also regulated, managed, and brought into the light. And that seems to be quite challenging, I mean, from what you described in Canada. One thing I wanted to come back to is the idea of, you said, of growing yourself, of self-cultivation, home cultivation. There is a risk, isn't there, that this is forgotten, that we go for a fully commercialized form of legalization, perhaps even a monopoly where few select growers dominate the market. How can we avoid that?
Well, by legalizing cultivation, personal cultivation, of a certain number of plants. I mean, that's the most obvious way of avoiding that problem, because this is the thing. Like, people also complained in Canada that where there were, I forget, 7 or 8 cannabis laws, there are now 48. Because it's been legalized in a certain way, and they want you to do they want you to use, buy, and distribute in a certain way. And if you fall outside of that, you now have heavier penalties and more opportunities for creating a misdemeanor or crime.
Oh, I see. And is that also enforced?
Yeah, apparently so. Yeah.
Mm-hmm. Yes, I can imagine it's very difficult for enforcement agencies to change their pattern of conduct, like for any other organization. There has now, one thing that's really noticeable in the whole cannabis field is the arrival of financial investors, bankers, speculators, and so on. And in your view, what is the role that they have to play, if any at all?
Well, I mean, these companies, because of the costs involved in getting a permit and going through the regulatory channels, it requires investment, and heavy investment. Mm-hmm. So that's a necessary step. I think the problem is not to limit it to big investors and to enable more, like what they have started in the States, micro growing. I think they've done it in Canada as well, micro growing permits. So for smaller businesses and smaller enterprises to get involved, and there'll be loans and technical assistance and training and how to jump through the hoops for smaller businesses, so that you don't have, big pharma, big cannabis dominating the show.
What about, as you mentioned earlier, people growing their own?
In relation to what?
Is that legal in different Canadian states or US states?
Yeah, well, it is legal. You can grow a certain number. It varies from province to province and state to state, but most of them have some yeah, regulation around home growing.
Well, coming back to sort of big commercial firms and financial investors, in a way, their deep pockets are required to fund the entire setting up process, the licensing and so on. And you might also need their financial clout in order to help the policy change to come into effect. You need the lobbying at policy-making level. There is, however, the risk from a public health perspective of the commercialization of cannabis and maybe greater use with perhaps public health risks that entails.
Well, you can make laws, obviously, against glamorizing the product and pushing the product. So you can prevent advertising. You can have limiting branding. You can keep things. You have very simple packaging. You can stop there being a kind of sales push, really advertising push.
Okay. And what about driving under the influence? Is that
driving under the influence? Well, obviously that's potentially a problem, as it is with alcohol. And there's varying. I think I've read conflicting reports as to whether this has increased, road traffic problems. I think the jury's still out. I think they need to collect more data. But there's obviously ways of checking and educating people about it, and just like we do with alcohol.
I think there is no compelling evidence to show that there has been an increase in road accidents and fatalities related to as a consequence of cannabis legalization, which I think is interesting. It's counterintuitive. Has to do perhaps with the fact that there's less alcohol consumption as a consequence of the very availability of cannabis, and that impairs drivers far more than cannabis ever did. Okay, just finally, for one interesting consideration for me is, if we have legalization of cannabis use, what should happen to the people who have criminal records for cannabis offences? What do you think should be done for them in your view?
So I think it's essential for expungement to happen at the same time that any kind of policy change takes place, so that people with criminal records don't get left behind. I think that's definitely been a problem in Canada, that they haven't had expungement. They've just had suspension of records, and even suspension of records required significant cost to put in an application for that. I think it wasn't done automatically. You had to apply, and it cost $600 to apply, and then it took time, and obviously that put off a lot of people. Whereas in various US states, it's just been automatic expungement. And I think that there's part of the problem of sort of social justice, that people who are pro drug policy reform really thought we could right the wrongs of the drug war, by social equity programs, but part of that, it's essential to expunge criminal records.
Yeah, absolutely.
Clear that, and then facilitate the entry of people who have been criminalized for decades into the legal market.
Absolutely, and that often also is a great injustice. That the very people who fought for this many years ago are now barred from benefiting from the normalization of cannabis as a legal commodity. Okay, thank you. Just final words. What do you think, in a nutshell, would be the benefit of cannabis legalization in the UK?
Well, I think obviously the most important is to stop criminalizing people for their drug use and to remove the stigma. But there's also massive economic benefits and the potential to allow people to access to their medicines without fear of criminalization or stigma.
Hattie Wells, thank you very much for your time, and we look forward to seeing you on the 1st of April.
Thank you, Axel. Thanks for having me.